It's October, so you know what that means. It is Breast Cancer Awareness Month. We are teamed up with the MedStar Health Cancer Network, taking your calls and answering your questions. And lucky to have Dr. Jennifer Flaim in the studio here with us. She's a radiologist at MedStar Health Bel Air Medical Campus. If you go to the doctor, I know what it is like for a woman. When you go to get that mammogram every year,
yes,
all the terms and terminology is thrown out at you. Yes. What does it mean if you need a biopsy?
So if you need a biopsy, that means you've come in for your mammogram, we've evaluated it, and we see an area that we think needs a tissue diagnosis. So we can do that several ways. We can use an ultrasound to guide our biopsy, or we can use the mammogram itself to guide the biopsy. Additionally, we occasionally use MRI to guide our biopsies, depending on how we best see an area of concern. So we get a tissue diagnosis, they can tell us what it is.
And so what if you need an upright stereotactic biopsy?
Okay.
Is that new technology?
Great, yes, that is new technology. That's something that we're very proud of having at MedStar. So we do have 3D mammography. The upright biopsy, historically, a woman would have to lay on her stomach, a little bit hyperextended. It can be uncomfortable. Some patients aren't really able to do that if they have lung disease. The upright biopsy really makes it available to almost all patients that can undergo biopsy. And additionally, with the upright biopsy, we can use that 3D imaging, that new technology. If that's the only way we can see it, we can still target it. So it's a great adjunct to all of our other methods.
A lot of folks out there don't have insurance and they're sitting at home watching, maybe thinking, what if I need this test? I can't have it, I can't afford it. What happens if you're low income?
Well, there are programs in place, and we really never want anyone to have a barrier to good health care. So in Maryland, we have BCCP, which is, pardon me, I'm going to look and make sure I get this right, the Breast and Cervical Cancer Diagnosis and Treatment Program. And in this particular program, if you are a low-income family, a low-income woman, if you're uninsured or underinsured, they can, you know, after answering a few simple questions about income, your family size, your insurance status, they will get you in touch with a provider that provides clinical breast exams, clinical pelvic exams, cervical cancer screenings, as well as breast cancer screening. And I have a couple of numbers here in case anyone out there is in need of this service and doesn't have access to that. In Harford County, our number is 410-612-1780. And in Baltimore, the number would be 410-767-6787. You can also Google the BCCP program and get additional information.
Dr. Flaim, thank you so much for coming in.
Thank you.
Just want to let you know that our operators are going to be standing by right next door in Studio B. The number to call is 410-481-2222. We have lots of nurses and experts and radiologists like Dr. Flaim standing by to take your call.